Hi, my name is Chantal Watson. I am a community health worker out of Prince George's County. I'm here today to talk with you about a digestive disease known as hemorrhoids. So we're going to get into what hemorrhoids are. What we do know is that they're painful. It's something that you would go to a GI doctor to talk about, and it's something that people may be shy to mention in an open setting, but just know that hemorrhoids can affect anyone and everyone, both male and female, young and old. All right, so here's a nice little diagram here. If you take a look at this top area, this right here will show you exactly what hemorrhoids actually are. So hemorrhoids are an inflamed tissue. The hemorrhoids are enlarged veins that are located within the tissue um, around your rectum and your anus. And if you really take a look here at this diaphragm, it'll show you just right there where that blood has been trapped inside. It has burst in that vein underneath the tissue and has become enlarged. This is now an example of internal hemorrhoids. All right. If you look on the diagram here, you'll see that the external hemorrhoids are located right outside of the rectum. So here in red, circle for you, this right here is internal hemorrhoids. It is above the sphincter. And here at the bottom, let's put this one in. Let's do a little purple. We'll do this one here. This one right here that I'm circling now. This is your external hemorrhoids, and this is located on the outside of the anus. These here in this area are way more painful than the ones on the inside. This area here have sensitive pain nerves that are exposed that cause this area to be more sensitive than the internal hemorrhoids. And very early on, you will know that there's something wrong in this area if you experience an inflammation. So what are the risk factors, right? So there are many risk factors, not a lot of documentation, not a lot of studies have been done. What we do know for fact is that having a low fiber diet contributes to inflammation of hemorrhoids. This because the stool is hard, and then upon uh, having a bowel movement, you're passing hard stool. It's rubbing and hitting against the soft hemorrhoid cushiony tissue, and that tissue is thin, and those veins become ruptured, they swell, and so forth, which will contribute to you having hemorrhoids. Also, childbirth is a risk factor because depending on the how much pressure is being applied to the colon area, that may tear or rupture some veins, causing the pregnant mother to experience hemorrhoids. Certain jobs can be a risk factor. If you're sitting for a long period of time, if what you're sitting on is poor cushioning and not supportive, that can become a risk factor for you. So sometimes your jobs become a risk factor. Having bathroom habits that are bad, being in the bathroom unnecessarily or on the toilet long, on your phone or reading unnecessarily, having that pressure and no support of the rectum with um, the pressure could also cause a person to have hemorrhoids. And of course, there's age. The most of the documentation that you do see are going to be from patients up over the age of 45 or around that age or older, and both male and female equally. So, what are the signs and symptoms we should be looking out for? Well, let's talk about first, we're going to talk about the internal hemorrhoids. Internal, again, are not quite as painful. They're not typically painful right away, so they're kind of hardest to detect. The redness and the tearing and the swelling of the veins are present, and they can be mild, they could be severe. It can cause bloody stool. It can also cause colon prolapse, and that is when that tissue becomes very enlarged, and then it will actually push through the rectum and protrude through, and then that can possibly become very painful. So then here we have external hemorrhoids. External hemorrhoids are a lot of redness around the rectum. There's swelling, there's pain, there could be more bleeding than normal. When you then with external hemorrhoids, there could be excessive blood when you use the bathroom because you're tearing all of the tissue that's around the colon on the outside of the body, so the redness will be brighter and more present. Sitting down could be difficult, wiping could be difficult. So sometimes walking could be difficult because of the motions. So external hemorrhoids are definitely by far more severe to the patient, more noticeable, and more of an issue. So, when you do see your GI doctor and you want to go over what is going on, why this is happening to you, and what you should do to prevent that, um, they're mostly going to direct you to having a better fiber control in your diet. They're going to want you to up the fiber, up the water intake, and then those two things together help equally bind bile and pass it with a smooth process versus if you're having a low fiber diet and your stool is hard. There's really not a lot other than that the doctor's going to tell you. They may ask questions about your bathroom habits. Are you straining? How often do you go? And so forth, and things like that. There are um, outside of medical reasons, there are those other personal reasons that could contribute to you having hemorrhoids, and that is something that you and your doctor maybe could speak about, um, and you can get the information that you need. But overall, it's having a better fiber, having plenty of water, and getting that regulation going in your system, with your system. There can be many of different long-term effects depending on the patient and depending on the severity of the hemorrhoids that are present. If you have internal hemorrhoids and they are not really an issue, they do not flare up occasionally, then most likely there are no long-term effects. You would just eventually know how to relax the tissue if you do have a flare up. Um, Overall, it's just an inconvenience. It's an inconvenience. It can be painful and annoying to have to deal with hemorrhoids and their flare-ups, especially if they're coming and you don't know that they're coming or you don't know what the cause is. Complications of using the bathroom can also be a long-term effect for someone who is not able to treat their hemorrhoids and prevent them from returning. The doctor's going to probably recommend over-the-counter medications, possibly a suppository or a sitz bath. This is the most recommended treatment for this disease. Fiber maintenance is always going to be number one. The doctors are going to always go back to fiber, 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 water, water, water. But there are over-counter creams and suppositories and sitz bath that could help or aid you with soothing your rectum and soothing the areas until the inflammation subsides. In very severe cases, a doctor may do a colonoscopy or sigmoidoscopy to locate the hemorrhoids and to see actually under a real close microscope how severe they are and what may need to be done. He may even suggest a hemorrhoidectomy if the hemorrhoids are that severe. With a hemorrhoidectomy, it's normally the last case scenario because it's a painful recovery for a painful disease. So if your hemorrhoids have gotten to that point and become a very severe problem for you, your doctor may suggest that you have a procedure that could be done in an outpatient setting. But again, that's not something that's common. This scope that you see right here, this is a GI doctor, and he is giving a colonoscopy, which would, at the end of this scope right here, at the end of this scope, has a little teeny tiny camera, which he can see here on this screen, and that can let him get nice up and close and see what is going on. Sometimes hemorrhoids could be polyps, and then if that was the case, if it's a polyp, then the doctor can use a tool called a snare, which he would then insert into the scope and wrap around the polyp and remove it by stopping the blood circulation and popping it. They would then send those out, test it to make sure it's not probably cancerous or any of the things that could become a problem and continue to cause the patient an issue. Overall, hemorrhoids are there for everyone, and hemorrhoids can be a problem for anyone. And we just need to really practice our good bathroom habits, our good healthy intake for good healthy output. I hope this video was informative for you. I hope that you got some good information that you could use. And if you know anyone who's suffering from hemorrhoids, hopefully this video could give them some insight on where to go, what to ask for, and what to look for. Thank you so much for your time.